In this video, I'm going to talk about oncologic emergencies, or emergencies that can be caused by cancer. So starting with superior vena cava syndrome. Superior vena cava syndrome is a compression, or the compression of the superior vena cava by a tumor, tending to lead to interference with venous return and subsequent engorgement of the vessels of the upper extremities and the trunk. Signs and symptoms of superior vena cava syndrome can include edema, particularly in the upper half of their body, so facial edema, periorbital edema, or edema in their fingers, hands, or arms. Also erythema in the face, neck, or upper trunk. Erythema is like redness. Engorged superficial veins of the thorax and upper extremities. Dysphagia, or difficulty swallowing, respiratory compromise, and intracranial hypertension. Management of superior vena cava syndrome can include radiation for the mass, steroid therapy, chemotherapy, respiratory support, limited activity, avoiding straining, bending, or lifting, and keeping their head of the bed elevated. Moving on to hypercalcemia. Hypercalcemia is an elevation in the serum calcium because of skeletal destruction secondary to primary or metastatic disease of the bone, which leads to calcium release in the blood, or it could be caused by ectopic production of chemicals by cancer cells, or it can be caused by prolonged immobilization. Signs and symptoms of hypercalcemia can include confusion, lethargy, weakness, stupor, coma, constipation, anorexia, nausea and vomiting, and renal calculi. And disseminated intravascular coagulopathy is another emergency that can occur. So it's also commonly referred to as DIC. So DIC is a serious disorder in which the proteins that control blood clotting become overactive. So it could cause hemorrhage or diffuse coagulopathy, or both, caused by abnormality of the blood clotting system. So sometimes what happens is all these clotting factors are all used up because of increased clotting, and then it'll cause hemorrhage because the clotting factors are all used up. So usually what happens is just both. So this is usually caused by release of thrombin or thrombin-like material from cancer cells. Signs and symptoms of DIC can include bleeding, shock-like symptoms, and abnormal clotting studies. Another emergency that can occur is septic shock, which is ineffective tissue perfusion due to systematic infection. It can be a reaction to existing pathogens in immunocompromised patients also. Signs and symptoms of septic shock can include infection, hypotension, decreased urine output, confusion. Okay, next, cardiac tamponade is another complication or emergency that can happen because of cancer. It can be caused by a tumor or a fluid containing cancer cells in the pericardial sac, leading to compression of the cardiac muscle. Causes can be pericarditis with effusion, pericardial tumor, or post-radiation pericarditis. Signs and symptoms of cardiac tamponade can include JVD, or jugular vein distension, rapid and weak pulse, pulsus paradoxus, dyspnea, cough, pain, and restlessness. Management for cardiac tamponade would include immediate pericardiocentesis, radiation therapy, sclerosing agents into the pericardial sac, and corticosteroids. Another complication or emergency that can happen is SIADH, or syndrome of inappropriate antidiuretic hormone. So just remember with SIADH, they're going to have decreased urine output, increased specific gravity, and then fluid volume excess with hyponatremia. So SI-ADH is a common complication having to do with lung cancer. So just wanted to touch briefly on that. And then lastly, tumor lysis syndrome is where electrolytes and toxins are released into the system caused by the breakdown of dying cells. So it's kind of like Cushing syndrome. These patients will have hyperkalemia, hyperphosphatemia, hyperuricemia, and hypocalcemia. Some symptoms kind of associated with that could be weakness, paralysis, arrhythmias, all due to hyperkalemia, or they may have nausea, vomiting, anorexia, muscle twitching, tetany, seizures, altered mental status, cramps having to do with hypocalcemia. There's a lot of different ways that they can manifest this, but this is a life-threatening emergency. Treatment for tumor lysis syndrome can include IV fluids at 150 mils per hour and a K-exolate enema to treat hyperkalemia.